You plan for everything, but nobody planned for this. When a stroke enters your life, the medical team knows exactly what to do. The doctors, the nurses, the therapists, they handle the crisis, and then one day they send your loved one home, and suddenly you're the caregiver. No training, no manual. What we discuss on this show is what I wish someone had handed me on discharge day. Real information, honest conversation with someone who knows exactly what you're going through, because I've been there too. So let's begin the conversation. Today, this is our very first podcast, and I have a very special guest, Jason Mayberry. Jason is the Education Director and Stroke Coordinator for Texas County Memorial Hospital. The neat thing about Jason is I met him, unfortunately, because my husband had a stroke, and I became part of the stroke world. So Jason and I are going to spend some time together today and talk a little bit about what you as care partners, as caregivers, need to know to make your life a little bit easier. So Jason, again, welcome to the show. And just tell me a little bit about yourself. What drew you to stroke care education in the first place?
Thanks for having me. And again, it's an honor to be the first guest on your podcast. So this is really cool. When I got out of nursing school, that adrenaline junkie that had to be in my hands and all the fun stuff, right? So I started working in emergency rooms, and I spent 23 years doing that. The last 11 years prior to this stint at Texas County, I was the ER director over at another critical access hospital in the town that I live. So I also had the responsibility of being the stroke and the STEMI coordinator for their TCD programs. After doing that for a while, and just becoming overwhelmed, tired from all the responsibilities, I needed a little change. So reached out over here to Texas County, and they had an education director open. And at that point in time, I was with the Association of Stroke Coordinators as the president. So I said, if you don't have a stroke coordinator, I'd really like to continue in that role. I can't just sit in an office all day long. I've got to get dirty occasionally. And it just happened to be an open position here as well. So I was able to continue working with stroke patients here at Texas County.
Oh, wonderful. Well, Jason, from Stroke Survivors Care Partner, I just want to say thank you for all the work the stroke coordinators do. When I first was exposed to the stroke coordinator was unfortunately when my husband had his stroke, and I had no idea the amount of things that goes on in that little room to save lives, and it's phenomenal. So thank you so much for that. So when I was in there, as a background as having a nurse, I thought I knew everything there was to know about strokes. I had not a clue as a caregiver. So what are some of the misconceptions that you see, some of the common ones about stroke recognition and how people respond, especially among like the families and the caregivers themselves? I'm learning more and more as I talk to caregivers, but I'm curious to see what your thoughts are and what are some of those misconceptions.
When I first came over to Texas County, we're in the middle of Missouri, down a little bit south. We are the biggest county in the state, but we're also socioeconomically one of the poorest as well, right? So when I first came over here, I was reviewing old stroke logs and just trying to figure out where they were as a program. One of the most disheartening things that I found is that our last known well to the first medical contact that these patients would have was sitting around 3 to 4 days before they would come to the hospital. So I started interviewing all the stroke patients that came in or their families. And I was like, hey guys, why wait? What's wrong? Or what do we need to do to make that better for you? And the majority of them said, my great grandfather had a stroke and they came to a hospital and they were just sent home with their stroke. And, they were paralyzed or they couldn't do this, couldn't do that. And I was like, my goodness, guys, that was how many years ago? Like there's been such advancement in stroke care. There is a lot that we can do. So we put a huge outreach into our community to just start saying, hey, these are the things that we can treat. This is how we do it. The care is much better these days. Medicine is constantly evolving. Trust us with your loved ones, right? We'll get the right decisions made. And if we can't care for them, we'll get them where they can. And that's something we could change, something that we can't change. Unfortunately, was people's fear for cost, right? I mean, you've got farms down here that have been in families for 200 years, and century old farms, and they don't want to be the person that loses it because of medical bills. So, that's something that I can't really change. Something that we're working on being very transparent about, and being able to help folks the best that we can.
Jason, that is so accurate. Even in the city of St. Louis, where I'm in a metro area, when I went into the hospital and was in the intensive care unit under my husband, I realized the huge education gap between the medical profession and caregivers. Even as a health professional, I was shocked at how the lack of information that's really out there to answer those kind of basic questions. And it was very scary and frightening. So I can imagine what individuals that don't have a healthcare background feel like. One of the biggest fears I hear so much from caregivers is one, how do I recognize if my loved ones are having a stroke and I should get help? And the second thing is, what happens if they're having a second stroke? How do I prevent that? So I'm curious if you could just share a little bit about what caregivers and loved ones can do to identify that their loved one's having a stroke and get to the hospital. And then how can they identify if it's a second stroke, or what do they do? I think most of us panic. So what can we
Sure.
do besides panic?
Absolutely. So one of the great things that the Association of Stroke Coordinators does is some of us are able to go out into fifth grade classrooms and we talk to fifth graders about stroke care. From a healthcare background, as well as I do, I can talk until I'm absolutely blue in the face. But family members won't necessarily listen to me, right? But they do listen to their kids. So we go in and we teach the fifth graders, and I do the same presentation. I take out the word fifth grade education when I do it for the community, but I give them the same information. We always teach these kids be fast. It's something AHA has done for a long time, is fast, face, arm, speech, and time. But recently to gather more posterior strokes, then we look at balance and eyes. So the new big thing that we're doing is be fast. So, if someone's having issues walking, standing up straight, any balance issues that they normally don't have, that's a problem, right? Eyes, vision changes, blurred vision, cut vision, blindness can happen. The face is the classic one that I think everybody that hears the word stroke thinks of, with half of the face unable to move or paralyzed itself. Kind of looks like, I try to explain it to fifth graders, kind of like the Joker has half his face melting off, that's a problem. Arms, if they can't use their right arm and they normally can use it just fine, or if they can't hold a fork or a spoon and they normally do that okay, that's a problem. Speech, we talk a lot about slurred speech, and it's where the kids and a lot of the community kind of get a kick out of it. We just talk about, if you have family members that have dentures and you ever listen to them talk without them in, that's the kind of slurred speech we're worried about. And then obviously we highlight the time quite a bit, making sure that they get to a hospital that has capabilities to care for their loved ones, getting there within that time frame where we can treat you. We can't do a great deal after 24 hours right now anywhere. And that's across the board, whether you're in a small rural hospital or you're in, the big city level 1 facility. So we preach getting checked out quite a bit. That seems to be, what we focus on mainly with the education part. As far as a secondary stroke, we do see lots of people that come back in after a stroke diagnosis and their family will just say, you know what, something's different. So then we have to kind of drill down on what's different. Maybe they had a stroke that left them right-sided. They aren't able to use their arm. But what's important is, has their arm movement changed, or has their strength changed? So yes, I know it's weak, but is it weaker now than it was before? So that's kind of how we base those secondary strokes off of, is what's changed from the previous deficits that they've had. And that's where we focus a little bit more on there.
And Jason, that is so critical, because I know when I do caregiver education to families, and we talk about a second stroke. During that first year post stroke, We as caregivers tend to utilize the emergency room probably a little bit more than we need to. We panic and we come in a lot more frequently because any little change is like, "Oh, is it another stroke?" You have that fear. So, what you just said was excellent, and thank you for that. So, when we come in as caregivers with our loved one, they've had a stroke, they're in that emergency room. What is critical for that caregiver to know, to do? What is their role for you all when you're taking care of their loved one? What do you need from them?
So anytime that we have a time critical diagnosis patient come in, there is a lot of chaos. Um, Please, first and foremost, don't be scared by the amount of people, by the speed we're moving. Um, it's I've heard it been described as organized chaos before. To onlookers, it looks like you're running around like a bunch of chickens with your heads cut off, right? But we all have certain roles, and we know those roles, and we know what we have to get done. Um, the most important thing for us is the information we can gather from you, a last known well time, because that's what we base everything off of. And that can be tricky sometimes. You run into those people and they'll say, they woke up at 2:30 in the morning and they walked to the bathroom and they noticed their balance was off. And I'll say, okay, when was their last known well time? And they'll say, I just told you 2:30 in the morning. And I said, it doesn't work like that. When was the last time you were 100% normal for yourself? So then we have to start talking about bedtime. Were you normal when you went to sleep? Because that's what we have to use in the medical world for our times for treatment algorithms and things like that. Otherwise, just having the basic information like we talked about. If it is a secondary stroke, what's new? What's different than the deficits that they've had? And those seem to be the big things. Medicines, allergies, yes, all those are important. But in the grand scheme of things, there's only a few medicines that we're worried about when we start, trying to figure out if you're eligible for medications or the clot busters and things like that. So our staff's been trained to ask those specific questions. I don't care for taking, I don't know now, metropolol for your blood pressure. Like, yes, that's important, but in my world at that point in time, that's not that important to me.
Jason, it's interesting you say that about medications. Frequently, when I'm visiting patients after they've had a stroke, and I always try to reinforce with them, you need to tell them what medications you've taken in the last 24 hours. And the reason I always say that to them is because many of them are embarrassed that maybe they had taken Viagra that morning. And so when the doctors ask what medications you've taken, many times that isn't brought up. And it is a concern. Have you seen that with your patients? And this is something I've been trying to reinforce. You need to tell every medication you've taken in the last 24 hours and let the physicians decide if it's important or not.
Having a med list is something that's very helpful because, again, in those stressful situations, it may be something that completely slips your mind as a caregiver. It may be something that, maybe all these are new medicines to you and you don't know how to pronounce them, or you've only been on them for a week or something like that. And, just having a list, being able to provide that makes it a little bit easier for us. We're lucky in that our EHR or EMR, the electronic medical record, they pull from your insurance, your medicines and your allergies. So when you have something filled, our EMR reaches out and pulls that information to us. And it is very quick to be able to do. It doesn't take long at all. So that's been a big blessing to us as well, being able to have that backup.
Oh, absolutely. So, Jason, one of the things I found is once the patient somewhat stabilizes and you're now getting ready for the journey or the marathon of stroke recovery, what are the key things that you feel like caregivers, our care partners really need to be aware of before they leave the hospital so that that patient is safe and also that that patient has the best recovery possible? What are the things that caregivers really need to understand that are so important?
I mean, there's a lot. The main thing is, you rely on our therapy department quite a bit to help us with this. But when you start working with physical therapy, occupational therapy, and speech therapy, they're going to be able to do home evaluations. So whether that's them coming to your home, before the patient's able to be sent home, and they say, okay, these stairs. Now remember, your loved one can't lift their right leg. So now we need to start thinking something else. Or they've got a walker that they've got to use. I mean, there is just tons of stuff, and it's very hard. And you try and hit all these important key things, but there's inevitably something that you're going to miss, something that you may not even think about until the time comes for you to do it at home, and then you're kind of like, well, we didn't think about this one. What do we do now? So making sure that they're able to follow up with primary care or neurology, and we're kind of at a disadvantage where we are. Our nearest neurologist for stroke care is sitting around 90 miles away. And to be able to have someone that, maybe can't walk real well or requires assistance getting into a car, caregivers don't think about that, oh my gosh, now I've got to load them at 6 o'clock in the morning. It's going to take me an hour to get them ready. And then I got to do this and get down there and how do I get into the hospital? Where do I park? Do I have to go in and get a wheelchair? Do I have my own wheelchair? Like, there's just so many things, and it's a lot at all at once. And it's very unfortunate. But unfortunately, it's kind of a trial by error sometimes.
You know what? It sure is. When my husband left the hospital, I was so overwhelmed and overloaded with information. All of a sudden, I was the primary person to take care of everything, and even with a medical background, I found it overwhelming. And so, you and I have talked about providing a caregiver course from someone that's been in that situation to help them through it, and the things that not the medical things so much, but just the day to day things that you need to know. For example, we cover such things as how do you get through the first day? How do you schedule appointments? What does a physical therapist do? What is, just those sort of things. So from your experience, what are some of the things that caregivers, maybe if they had been educated about or supported about, would have prevented maybe their loved ones from coming back in? Or what are some of the things that, a story you can share of someone that you felt like, wow, when they got the support for this, they had a better outcome?
Start to think back at all the different things that you've seen happen over time, and what makes it better for people. And I think the biggest thing that we can do as hospitals is try and have somebody that's dedicated just for the family during the whole process. TCD does a great job of outlining support services. Having someone that can answer questions for the family while we're working with the patient, in that initial, in the time critical space. As far as, inpatient wise, I think there's a chance now to be able to open up and ask more questions. Having resources available, we try and pass out. We've got a stroke binder that we give out to family members that, it's pretty much ripped from AHA, but it's, preventative measures, things to do at home. It's got section for notes and questions. And, we try and give that to them when they arrive on the floor, give them, a day or so to look through it. And, if they just come up with a random question, they can write it down for the next time their doctor comes in or their nurse is in to talk to them, or, the stroke team's looking at them. Then that's available. We do stoplight toolkits that kind of give you, these are symptoms that you don't need to worry about. These are symptoms you should be, seeing a primary care about or neurology. And then these are symptoms that you got to go to the ER for, to be able to give them as much as we can. As far, for caregivers, it's important to know that the hospital staff is never trying to ignore you, right? We're going to give you as much information as we can, but if we don't understand your living situation, or financial situation, or stresses about bills, and now you got new prescriptions that are not always cheap, you've got to be able to ask those questions and ask for help, because again, it's not that you're forgotten about. It's just that they've got a lot on their mind that they're dealing with otherwise as well. So make your voice loud, and make it heard. Definitely.
Absolutely. And, I think one of the things that I really appreciate is finding out who do you ask the question to. So many times you get so many people come in the room and they leave with do you have any questions? And as a caregiver, you're like, I don't know if I have a question, or I don't know who to ask that question to. And I think if you could just explain a little bit about the stroke care coordinator, because I feel like that's the individual, at least in my experience, that kind of brought everything together. I kind of, you know, did not have always the answer for every question, but kind of knew who to ask. And so, is that a pretty common experience that I had, or is that really the role of the stroke coordinator? And is that really the central person that they should, while in the hospital, kind of look to for that assistance?
Yeah, I mean, ideally, I think it is 100%. I think each facility is going to be a little bit different. I am a stroke coordinator of one. That is me. So I'm looking at the charts. I'm working the protocols. I'm running to all the alerts to try and assist the staff. Some hospitals have a stroke team that has a coordinator, but then they have 4 or 5 people underneath them that are able to round on the patients every single day when the doctors are there. We've been very, I don't, I'm not quite sure how to say it. We've been very lucky to have additional staff that support me, even though they don't have to. I've got a case management team here at the hospital that is phenomenal. They round every single day. If they have a question or a question's brought to them and I'm not there, they call me, they text me, hey, patient had this question or family had this question. I don't know how to answer it. And I've given everybody the autonomy to take any question they want. By all means, if you can't answer it, find me. If I can't answer it, I'll find someone else that can. So again, I think every hospital is a little bit different. The stroke coordinator is a good person to ask, but at the same point in time, that floor nurse that has been seeing your loved one for the past 3 days may be able to give better answers than I do, because if I come up to answer a question, I may not know everything about how the process has been in the hospital where that nurse does. So we give them that autonomy to say, I can answer that for you, and let me do that now, and kind of move from there.
That's exactly true. Number one thing is just ask. Just ask. There's no dumb question by any stretch of the imagination. And what I loved hearing from you is that, you're a one man show, but nobody's alone. So that caregiver doesn't have to feel like, oh, if Jason is off today, I have nobody to go to. There's always someone there that's wanting to help. So, Jason, I want to kind of just wrap up a little bit. This has been, oh my gosh, so much great information. Um, and you and I have met with the other stroke coordinators in the area and talked a little bit about the course that I have been talking about in helping caregivers. And I'm curious from your perspective, what benefit you would think there is for a caregiver to our family member to go through a caregiver course of kind of what happens after the crisis.
Yeah. Well, I think it's phenomenal. Again, if you can go through someone's lived experience and learn from that, there is no greater knowledge, because again, they probably walked through more of the aftercare with patients than I have. Um, that being said, we try to get together like stroke support groups where, we bring in caregivers or survivors of strokes, and we get them in a room together. We feed you. We might have a topic of the day or a topic of the month, however often we meet, but then they just have a chance to sit down and talk to each other. Hey, I experienced this. What do you guys know about this, or what resources are out there for this? And, I think, and again, anytime you can learn from someone who's been through it before, there's the benefits are just extraordinary to be able to have that available.
Well, Jason, I really want to thank you for your time. And more importantly, I want to thank you for your dedication to stroke care. Without individuals like you, without your education, your knowledge, your commitment, and your just enthusiasm for stroke care, I would not have brought a husband home. And that makes a difference. I know it must be difficult as a stroke care coordinator to see someone come in a crisis, and the look on all of our faces of what's happening, and knowing that, 5 years down the road, they're doing a podcast with you, and that, there is life after stroke. There's good days and bad days, as you well know, but through education and support, we can all make a difference. So again, thank you. Is there any last things you'd like to share with our audience before we close?
I think this has been a phenomenal experience for myself. If you're listening, like my kids say, you need to like and subscribe. You get yourself on here, do it all the time. Again, any information that you can get in regarding to the care of your loved ones that have had a stroke, extremely beneficial. Medicine is, like I said, constantly evolving and changing. So just trying to stay up as current as you can to make sure that you're giving them the best chance for the life that they have after their event. Absolutely.
Absolutely. Well, again, thank you so much, and we'll close out this session.
Awesome. Thank you very much, Lana.
Every episode, my goal is simple, that you leave knowing we're in this together. Caregivers don't have to figure things out on their own. My hope is to share the education that you will need and to provide resources of value. If today's conversation helped you, share it with someone who needs it, a family member, a nurse, a friend who's going through this right now. That's how we find each other. I'm Lana. Thank you for being here. I'll see you in the next conversation. Make sure to stay connected on social media at Stroke Caregiver Connection and on my website, strokecaregiverconnection.com.